Hello and welcome to La Excellence Hyderabad and Bangalore. This is the daily news analysis for 2nd May 2020. The important articles of the day, as usual, have been divided into deep and targeted news analysis. Deep consists of the daily editorial articles that are there, and the rest of the important articles are clubbed under targeted news analysis. Now let's move on to our discussion. The first article for the discussion has the following title. It's about food, nutrition and livelihood security. The syllabus connection for the same has been pointed out here for your benefit. Please have a look. The issue here is related to COVID crisis, and the dimension we are going to discuss is about the food and livelihood security in the context of COVID crisis. Now let's see what this article is trying to tell us. So what is the current article trying to tell us? It says the following. The current national lockdown that we are having to tackle the COVID pandemic, it has highlighted the problems of food security, nutrition security and livelihood security. And how is that the case? In order to understand that, we have to first define the idea of food security as such. So what exactly is food security? Food security has certain components under it. The first component is the availability of food in the market. Only when food is available in the market, consumers will go to the market and be able to purchase the food that is there. So availability of food is the first and foremost criteria that is required to ensure food security. The second criteria of food security is the access to food. And what do we mean by the access to food? It is basically the ability to access the food that is there in the market, and it is directly a product of the purchasing power of the person. Like for example, if a person has a good amount of money with him, he can access all kinds of food. He can access even the fruits which are costly and so on, and so he has more access to food. But if the person is poor, he doesn't have enough money to go and purchase in the market, and it is going to hurt his nutritional security. So basically the access to food is basically a product of the purchasing power of the person, is what this article is trying to tell us. So there are two important things which are related to food security. One is the availability of food and the second is the access of food. And how exactly do we ensure access of food? By the way, we can ensure the access of food firstly by creating job security. If people have job security, they will have constant disposable income, and they can use this income to buy whatever the food they like, and the food that is important for a balanced diet, all these things they can buy. In addition to this, in order to ensure access of food, we should also improve our distribution and transportation channels. What do we mean by that? If a good amount of goods are being produced in the farm, like for example you produce all kinds of fruits in your farm, but if you're not able to transport these produce, if you're not able to transport this produce to the point where consumer buys this produce, then there is no point in producing them, right? So in order to ensure access of food, you have to make sure that the food that is produced, or the fruits or wheat, rice, whatever is being produced, it has to be able to reach the market. This is one other important criteria for the access of food. So we talked about the availability of food, and we've also talked about the access of food as an important criteria under food security. In addition to all these things, there is also another important criteria which we call as the absorption of food. As in, if we are basically having some food, if we are consuming that food has to be absorbed well into the system of our body, so that it will give us the maximum benefit, so that we can function well as human beings. And this is only possible based on certain factors like the drinking water that we have, the sanitation around us, and other non-food factors like the public health services that are there which take care of us, and so on. So all these important angles, important legs of food security have been listed here. One is the availability of food, second is the access of food, and third is the absorption of food. Having discussed them, we'll talk about the problems that are faced by farmers as well as consumers during this pandemic. So we will list them out. First problem is the inability to harvest. This has manifested in the following manner. If I am a farmer and I have produced so and so good, I should be able to first harvest it so that I can transfer it from one place to another place. But that is not possible because of lockdown. This is one problem farmers are facing. And the second is, even if I am able to harvest my good, I have to move this harvest from my place to the place of the market, and this is not possible because the transportation networks are not functioning well. Because of the COVID pandemic, all the transportation has been shut, and because of which I am not able to move my produce from the farm gate to the market. Because of all these reasons, the farmers have been making losses, and they are not able to pay their debts back to the debts or loans back to the places from where they have taken money, and so on. That is another problem. In addition to all these things, there is also a problem of micronutrient deficiency. If you look at the diet which we people have, it has to consist of both macronutrients as well as micronutrients, and these micronutrients usually consist of vitamins, minerals, and so on. They are usually present in fruits and so on. These we are not able to consume at this point of time because they are not at all available in the market in a big manner because of the lockdown. That is another problem that we are facing. So these are the problems that the farmers and the consumers are together facing at this point of time, is what this article is trying to tell us. In order to solve this problem, they are basically giving a way forward. First is to ensure food availability in different parts of the country. The way to ensure food availability is to basically revive the transportation chains. You should be able to transport the food that is in excess in certain areas or near the farms, and you should be able to transfer this food from this point to a place where the food is in deficit. That is one thing that is important, for which you have to improve your transportation channels. In addition to this, you also have to develop your cold storage facilities near the farm, so that farmers will be able to decrease the perishability of the produce. In addition to all these things, you also have to improve the Manrega work or resume the Manrega work, because people as such will have more disposable income at their disposal, and they will be able to purchase the food or access the food as such. These are the different solutions that have been given by this particular article. Now let's move on to the next article. So the title of the present article is Taiwan's Coronavirus Protocol Shows How It Is Done. The syllabus connection has been listed here for your benefit. The issue is related to COVID-19 pandemic. The dimension is basically the global practices that are adopted throughout the world, the standard operating procedures, the good practices that are being adopted by different countries are coming up in the articles from time to time. Today we are talking about Taiwan. Few days ago, we talked about how Singapore basically has started testing its people in a big way. It has started home quarantine and so on. All these measures we talked about Singapore, and today we're talking about Taiwan and how it has been able to handle the pandemic in a very efficient manner. Now let's move on to the discussion. So what does the article say? At the outset, this article basically first acknowledges the efficient way in which Taiwan has been able to handle the situation. And why has Taiwan been able to do it so efficiently? It is because some time ago, when there was this SARS outbreak, SARS outbreak, it is also a flu-like disease. When this outbreak was there in the world, it has affected Taiwan very negatively. It hit hard Taiwan. That is what this article says. And since then, since the SARS outbreak, Taiwan has always been in a state of alertness. It has always been in a state of constant readiness to handle any kinds of infectious diseases, and this is the case in which it has proved its mettle. So when COVID-19 has started affecting the world, Taiwan has started its actions very fast in order to handle the situation. So we will first list out the kind of measures that Taiwan has taken in order to handle the situation. This gives a sense about how India has been performing, and also it tells us how India should tweak its present strategy in order to perform much better. Because if you look at the recent cases that are springing up, especially in the last 2 or 3 days, we are clocking around 1500 to 2000 cases per day, which is not good. So adopting a standard best practice, adopting in the best practices which are used in Taiwan could be a way forward. That is some learning for India. Anyway, we will come back and we will look at what Taiwan has done really. So firstly, the day it has realized that COVID pandemic is going to be a problem, and it realized this very early, by the way. So once it realized that COVID-19 is going to be a problem, from the very first day, it has started the process of onboard quarantine. So whatever direct flights used to be there from Chinese Wuhan city to Taiwan, all these direct flights have been given the facility of onboard quarantine. All the passengers that are there in those particular flights were being quarantined, and necessary steps were taken. That is the first safety step that they have taken. In addition to this, whenever you look at the pandemic graphs, whenever you look at how countries are functioning in the times of pandemic, there is usually a difference of opinion, as in there is usually a conflict between different ministries as to how to handle the situation, as to how to come up with new measures to handle the situation. This is usually reconciled by the prime minister's office, etc., or the home minister, and so on. But Taiwan, what did it do? It came up with what we call as the Central Epidemic Command Center. It was immediately established, and this Central Epidemic Command Center was established to effectively integrate the resources from various ministries. From whatever ministries were there, all the opinions were consolidated and all the resources were integrated and brought under Central Epidemic Control Center in order to handle the situation very effectively. So that this Central Epidemic Control Center, this invested itself fully in the containment of the epidemic, and it has been largely successful. In addition to all these things, it has also set up very strong border quarantine. All those people who wanted to come into Taiwan through the borders, they were basically quarantined, and if certain problems were found, a 14-day home quarantine has been recommended for people. Next came the problem of identification of people who are affected by this COVID crisis, or they affected by the COVID disease. So in order to do it, it basically came up with an electronic system. It came up with an electronic system in which all local people could register themselves with their mobile phone numbers, of course, and they were all basically urged to fill in their health information. Okay, so this is the step that it has taken, and once people started filling the information in this particular electronic system, and this electronic system has been integrated with the community care support, as in this electronic system used to take information from the people as such and assess the risk at which the different kinds of people were there, and they used to provide calibrated support to these people, to those people who were at more risk, with the help of the community care support system. So this electronic system on one hand connected people, on the second hand it collected the public health system as such, so that both of them could benefit from each other. So this is one thing. In addition to this, they also integrated the travel history of a person on their national health insurance card. Now what is the importance of doing so? So let's say I am a Taiwanese citizen and I am not doing well. I have cold, flu, fever, etc., etc. If I go to the hospital, I have to produce my health insurance card in order to claim insurance, right? So when I produce my health insurance card, and if the information of my travel history is also present on the health insurance card, the doctor will be able to diagnose my problem better. Like for example, if in the past few weeks I have traveled probably to different parts of China, or especially to Wuhan, then he will probably diagnose my problem to be COVID, and he immediately will put me under quarantine. Otherwise what will happen is I will start infecting a lot of people, knowingly or unknowingly, of course, and this can be prevented by integrating the travel history with the health insurance card, and that is what Taiwan has done. In addition to all these things, Taiwan has asked people to home quarantine. Some people who are at more risk of contracting this disease, Taiwan has asked them to stay at home. Now, having asked them to stay at home, is it sufficient? No, you are also supposed to ensure that they stay at home, and this was basically done by GPS tracking of their locations. In addition to GPS tracking, they have also started imposing stringent fines and mandatory fines or spot fines when people started violating the lockdown norms. This is one other step that they have taken. And next, what else they have done? They've also increased the laboratory testing capacity. Once your testing capacity increases, you will be able to diagnose the extent of the problem. If your testing capacity is not good enough, how will you know about the number of people who have been affected by the disease, right? So they have also improved the laboratory testing capacity. They've also have set up designated regional hospitals and medical centers in order to create more infrastructure for testing as such. In addition to all these things, if people want to be safe, they have to use masks, surgical masks, and so on. In order to ensure this, the first thing they have done was to ban the export of surgical masks, so that they will have enough supply of surgical masks inside the country. And in addition to this, they have also increased the production of these masks at home. So in this way they have been able to ensure that different people started using sanitizing measures. People used to sanitize themselves regularly. They also kept wearing these masks all the time throughout the day in order to prevent being infected by the disease. So if you look at the different kinds of steps that Taiwan has taken, we have seen that it has taken a multi-pronged approach. It has tried to handle the problem from different directions, and this is the kind of solutions different countries have to come up. It is not just by testing, or it is not just by giving medicines to the disease that we will be able to handle the situation. We have to use a one health approach. We have to use a multi-pronged strategy in order to handle the situation. This is the lesson that India has to draw. In addition to this article also explores the link between World Health Organization and Taiwan. Like for example, Taiwan is not a member of World Health Organization, but Taiwan has really done well in the case of COVID pandemic and how to handle COVID pandemic. In such a situation, World Health Organization should not restrict itself. It has to basically take the best practices that are being followed by Taiwan. It also has to publicize them. So because COVID-19 knows no borders. COVID-19 doesn't know whether Taiwan is a member of World Health Organization or not. In such a situation, whichever country is performing well for whatever reason, we have to take all the good practices from that particular country, publicize them, and transfer these standard operating procedures and best practices to different parts of the world, so that the world as such as a whole will be able to handle the situation. So that is what this article says. World Health Organization should not neglect the contribution of any one nation just because it is not a member of the World Health Organization. We have to take the best practices from Taiwan. This is what this article says. Now let's move on to the next article. So the title for the present article is The Mystery of the Low COVID-19 Numbers. The syllabus connection has been listed here for your benefit. Please have a look. The issue is COVID-19. Of course, all the articles that we are discussing these days are related to COVID-19. That is because that is what is featuring in the newspaper these days. But the dimensions are different. One article talks about the standard operating procedures of different countries. Another article talks about the food security issue. And this particular article talks about the failure of certain states. A failure of certain states to handle the COVID-19 numbers. Like for example, if you look at the case of Telangana, few days ago the Prime Minister has basically praised Telangana for its efforts to contain the COVID pandemic. While on the other hand, we have states like Maharashtra, West Bengal, Uttar Pradesh, Tamil Nadu, etc. who are not doing so well in terms of handling the pandemic. I'm not saying they are not taking enough efforts as such, but whatever they are doing, there are certain systemic faults. And what are these faults? This article tries to explore. Let's have a look at it. The article first starts out by listing about the different initiatives that have been taken by the government in order to handle the COVID issue. Like for example, as soon as the government realized that the gravity of the situation, we have given out certain important steps. The first and foremost of them is to impose a nationwide lockdown, and we have done it for quite some time. We have done it successfully for a long time. So what are the other steps that have been taken by the government? The government has basically started giving out special packages to different states that are there, and certain states have also asked for special packages from the center that is there. In addition to all these things, the states have also set up quarantine centers in which people would be put if they are at high risk of contracting COVID, and a separate COVID-19 hospital has been set up, right? Task force which consists of a committee of doctors also has been established, and audit of the suspected deaths is also being done. All these things are being done on a nationwide scale, but West Bengal has also done this in a decent manner. But what led to the failure of West Bengal as such to handle the issue is what this article is trying to tell us. So the following are the reasons. Firstly, the way in which West Bengal has implemented the lockdown restrictions is not up to the mark. The lockdown restrictions were quite relaxed. People used to move out in crowds, and there was no police action as such on these people. The police were not able to handle the situation, partly because the restrictions themselves were quite relaxed in West Bengal. In addition to this, West Bengal, instead of talking about all the infections that are there, it only stated the number of active cases that are there. When you talk about a particular disease, and you have to first talk about the number of people infected in your area, and instead of doing this, you're only talking about the active cases who we have tested and diagnosed. That is not the right thing to do. And the next thing is basically large crowds started attending different events. In fact, large crowds used to aggregate before the ration shops or in the urban slums and so on, and the government has not been able to prevent this from happening. This is partly because it has not been able to create the kind of awareness that is required to push people to observe the lockdown as such. Okay, it has not been able to do so because of this lack of awareness. People thought that this was like any other kind of flu, so they started moving in crowds, and this has affected the state very negatively. And for a long time, in the beginning of the lockdown period, West Bengal didn't have enough testing capacity. Like for example, there is only one institute which we call as the National Institute of Cholera and Enteric Diseases, or the NICED. This is basically the only testing facility. This is the only testing facility that was there in the West Bengal in the first few days of the outbreak. So in the beginning itself, if you are able to diagnose your cases or infections really well, you will be able to handle the situation better in times to come. But in the beginning itself, you have not been able to diagnose the situation, partly because you don't have enough testing capacity, then you will have problems in the end, right? So that is what West Bengal is going to go is going through at the moment. In addition to this, the kind of testing that has been done, they have basically used the PT-PCR testing, RT-PCR testing. This is basically a one way of testing COVID. And this RT-PCR testing, whatever was being done by this kind of testing, the results out of this were basically inconclusive. So this didn't help West Bengal either. And next, what happened was the healthcare providers that were there in West Bengal, they started getting affected in a big way. The healthcare professionals, as in the ASHA workers, the nurses, the doctors and so on, these people who were supposed to be the bedrock of a hospital foundation, they started getting infected in a big way, and this has created some kind of panic in the other health personnel, because of which there is a decrease in which they were handling the situation, as there is a decrease in the seriousness in which they were handling the situation as such. This was another problem. And the next problem is the problem of infrastructure. In order to handle COVID-19 as such, the first thing you need to have is the mask, and then you need to have a good supply of sanitizers, and you have to make sure that you basically have access to these things in different nook and corners of the state. And West Bengal didn't have it. The N95 masks and the personal protective equipment that was required, all these things were not there either for the health personnel or for the people in general. So this created another problem. So because of these set of reasons, these set of flaws in the West Bengal system of handling COVID-19, it has basically ballooned up the kind of cases that we have in West Bengal right now. So this is one of the reasons why these are the set of reasons why West Bengal has not been able to perform well. That is what this article is trying to tell us. At least at this point of time, this particular government has to recognize this situation, and it has to work on itself in a war footing to handle this COVID-19 pandemic, is what this article is trying to tell us. Now let's move on to the next article. So the title for the present article is Economists Call for an Urban Job Scheme. The syllabus connection has been listed here for your benefit. The issue is related to the loss of employment due to the COVID-19 pandemic and the lockdown restrictions. The dimension is to strengthen Manrega in rural areas, and also to launch a similar scheme in the urban areas. So you basically need an urban job scheme, is what this article is trying to tell us. Now let's move forward and look into the gist of the article. So before we look into the highlights of the article, we first have to understand a brief background about the Mahatma Gandhi National Rural Employment Guarantee Act, which we generally call as the Manrega Act. It was launched in 2005. Why did we launch it? We basically wanted to ameliorate the poverty condition of the people. If you look at the kind of population we have, a lot of them are basically unskilled or semi-skilled, and it is really difficult for them to find jobs in the skilled market. So it is the duty of the government to protect them, and in order to do so, they have launched the Manrega Act. Manrega basically gives them a legal guarantee of a job. So it basically provides a legal assurance for about 100 days. For 100 days of employment is provided under Manrega in every financial year to adult members of any rural household. If you take any rural household, the adult members of the household are basically given this kind of legal guarantee of 100 days. And what kind of work will be done by these people? These people will basically take up unskilled or semi-skilled manual work, and the money that will be given to them is basically the statutory minimum wage, a bare minimum amount of money which is required for sustenance, which we call as the statutory minimum wage, will be given to these people as a remuneration. So who oversees this scheme of Manrega? This scheme of Manrega is basically monitored and implemented entirely by the Ministry of Rural Development. Does Ministry of Rural Development do it by itself? No. Ministry of Rural Development, in association with the different state governments that are there, it coordinates with them in order to implement this scheme in a better way. So what was the main essence of Manrega in order to provide this legal guarantee? It was introduced with an aim of improving the purchasing power of the rural people. By improving the purchasing power of the rural people, especially the semi and unskilled people, it wants to bring them out of the poverty. It wants to increase their disposable income so that they will be able to live a better life. And what are the other rules that are present under Manrega? Let's have a list of them. Firstly, you have to make sure that 1/3 of the workforce which is provided workforce under Manrega has to be women. So there is a gender component under it. So 1/3 of the 1/3 of the jobs that are there, they are reserved for women. And when work is done by people, be it men or women, when do we give the salaries? The salaries or the remuneration or the wages have to be given within 15 days. Within 15 days they have to be given, their wages have to be given. In case the government is not able to create employment for Manrega workers, like for example, I am the government, the act says that I have to provide them with the employment, right? And if I'm not able to provide them with the employment, I have to give them instead the unemployment allowance. So basically the Manrega Act forces the government to create work, and it also helps the government to make sure that the people get enough work so that they will be given, so that they can be given satisfactory wages, so they will be able to live well. In addition to this, who basically decides the kind of works which are done by Manrega? So what kind of work is to be done by Manrega? Who decides this? This basically is broad guidelines are given by the state governments, but it is basically decided at the Gram Panchayat level. And whenever a Manrega work is done, it is basically assessed by the people at that level. This we call it as a social audit, and the social audit is also a mandatory provision under the Manrega Act. Under social audit, the people of the Gram Sabha gather together and they decide whether the work has been done well, whether the work allocation has been done well, whether the way in which the wages have been given, is it satisfactory or not. All these things will be decided under the concept of social audit. So the jobs under Manrega are basically green. And why do we say so? This is because the kind of jobs that we provide, these are basically to increase the irrigation, to increase the farm ponds that are there, earthing works and so on. All these kinds of work in the rural areas basically make sure that the environment is more green. The environment is more green, and by doing so they are basically greening the society and greening the country as such. By doing so, they are able to help the government, help the country fight the climate change as such. This is why basically Manrega has a double benefit. On one hand, it basically ameliorates the poverty of the country, and on the other hand, it also helps the government to fight the climate change as such. In fact, if you look at the comments of different organizations on Manrega, World Bank has in fact called it as a stellar example of rural development. So this is the basic background of Manrega. Now we'll understand what the highlights of this particular article are. So this article basically tells the following: a group of social activists have written a letter. They have written a letter to the Ministry of Rural Development to strengthen the scheme of Manrega. They have realized that in situations like COVID, it is really important for us to strengthen the Manrega, because the rural population is going to swell up at this point of time. All the migrant population that is there, they are going to go back home. This will increase the number of rural population at home, and you have to make sure that these people have disposable income. And the tool which we have in our hand is the concept of Manrega. So you have to strengthen Manrega, and they have given certain provisions. The group of social activists who have written this letter, they have given a set of provisions. The proposals are basically the following. Firstly, you have to increase the funding of Manrega. Presently it is to the tune of 55 to 65,000 crores. Now you have to increase it to as high as 1 lakh crores in order to make sure that these people will get employment. And then you have to increase the 100-day limit. Initially, the Manrega Act has said that you have to provide 100 days of legal work, and now this has to be extended to 150 days, and even in fact to as high as a year, as in throughout the year you should be able to provide employment. And in case a person does not have a Manrega job card, you cannot turn the person away, as in you cannot ask the person to go away. You are supposed to provide for a situation for a system of on-site registration. The idea is to make sure that everybody has work, so you have to produce the system of on-site registration, so that person who does not have the job card of Manrega attains the job card and he will be able to work better. Now previously, as we looked into the rules some time ago, we said that if you work under Manrega, your wages will be paid within how many days? Within 15 days. And these people have changed this provision. They have basically wanting the pay to be given within 7 days. Within 7 days the wages have to be paid to people, and biometric based payments have to be avoided, because when it comes to the case of biometric based payments, people start aggregating, they start coming in groups in order to collect their salaries, which is not good. This is going to increase the spread of COVID. In order to prevent this, you have to let go of biometric based payments at the moment, but whatever salaries or wages you give, you have to give it within 7 days. And in addition to this, the certain categories of people have been recognized, like the sick people, the pregnant people, the people who are basically above 50 years of age, and then the disabled people. All these people basically have to be given their full wages even if they are not able to work. This is also another provision that has been recommended by this report. Now if we are looking at the kind of restrictions that we basically have divided different states, as in the states have divided different districts into the red zone, orange zone and the green zone. In the red zone, they have said that they are not going to resume any kind of work, but this should not be the case. Manrega work should be allowed to continue in the red zone depending upon the situation. Not in every red zone, but in some red zones, if the situation is different at the block level, it is wise to resume the Manrega works in order to pump in the disposable income into the hands of the people as soon as possible. This is what this article is trying to tell us, and the article ends the discussion by saying that you have to come up with an urban counterpart of Manrega. You need to have an urban job scheme to make sure that the people in the urban areas have a legal endowment of a job, they have the legal security of a job. That is something this article is trying to tell us. So overall, this article is about the recommendations of this group of social activists to improve Manrega, and the economists as such have talked about an urban job scheme. This is something that we have to think about. Now let's move on to the next article. The title of the present article is WHO raises concern over the use of BCG vaccine, and the issue is related to COVID-19. The dimension is the criticism on the medical steps that are taken in order to handle COVID-19. What this actually is, we will see in this article. The syllabus connection has been listed here for your benefit. Please have a look. So what does the article says? The article says the following. If you look at different countries and the ways in which they are handling the situation, a lot of them went for lockdown, some of them declared emergencies and all and so on. But currently everybody is trying to develop a vaccine, especially Netherlands and Australia. They were conducting trials to find out if this vaccine called the BCG vaccine can reduce the severity of COVID-19. What is BCG vaccine? We will first have a background about it and then we'll come back to the article. What is this BCG vaccine? It is basically a vaccine that is used to handle the tuberculosis or the TB disease. It is generally given to children within 6 months of their birth. So within 6 months of their birth, they are basically injected with this vaccine, and this vaccine has been very effective. It has been very effective. In fact, it was 80% effective in preventing TB for 15 years. But of course, after the child attains 15 years of age, the protective effect of the vaccines is not so much, but up to 15 years of age, this vaccine has been really very helpful and useful. So this is the background of BCG vaccine. Now what Netherlands and Australia are doing? Netherlands and Australia are basically trying to see if this BCG vaccine is useful for COVID-19. But the kind of trials they are doing, the kind of claims they are making, they are thinking that BCG vaccine is basically useful, and all these kinds of statements without enough evidence is going to cause a problem, is what this article is trying to tell us. World Health Organization has said that this BCG vaccine is used for a specific purpose for TB. If Netherlands and Australia start claiming that this is also useful for COVID-19 without enough evidence, so people in different countries will start buying BCG vaccine in large amounts. This will decrease the supply of BCG vaccine for those people who are really in need. Like for example, those countries who are basically very affected by TB, they will not be able to source this BCG vaccine. They will not be able to buy this BCG vaccine because of its short supply. So before we claim that this BCG vaccine is useful or very effective to handle COVID-19, we first have to make sure that the tests are foolproof. We first have to make sure that there is very strong evidence in the same. And next, there are certain evidences which say that the BCG vaccine may damage the immune system, and if it is really the case, it won't be able to handle the COVID-19, which is all right and fine, but it is also going to basically worsen the situation. It is going to lead to a further complication and even death in the case of a COVID patient. So you have to be really careful before making such false claims. And the next thing is, if we basically give people this COVID, this vaccine, this BCG vaccine, without actually testing it, we are giving them a false sense of security, which is not fair on the part of the government or the corporate firms that are there. This is the basic gist of this article. Now we will move on to the next article. The title of the last article is Kashmir Saffron gets GI tag. The syllabus connection has been listed for your benefit. The issue is related to GI or the geographical indication tag, and the dimension is the fact that different products from Kashmir have achieved this GI tag. Now we will move on and look into what this article is trying to tell us. So before we jump into the article, we first have to have a brief background about what geographical indication tag actually is, because it is really important from the perspective of prelims. So geographical indication tag is basically an intellectual property. So it basically says, if when a particular product has been given the geographical indication tag, it says that product has originated from a particular region only. For example, Tirupati Laddu of Andhra Pradesh, Chengilkod in bananas, and so on. So these products basically originate from a particular region only, and we are basically stamping on this product that this belongs to a particular region. So this gives security to the people who produce this product. And some facts which are important for geographical indication GI tag is, the first product in India with GI tag was the Darjeeling tea, and it was given, I think, in 2004 and 2005. As of now, we have as many as 344 goods registered under the GI registry of India. And what is the significance of having such a GI tag? Firstly, it ensures that there is an assurance of quality. Right, so when we give this particular good the GI tag, it ensures that this particular good originates from a particular region which is famous for producing that good. So it conveys an assurance of quality. It also gives a sense of distinctiveness to the product, and that is one of the important significances of the GI tag. The next thing is that the person who has the right of GI tag, the right holder of the GI tag, he can prevent its use by a third party. Like for example, if I produce a product which is a GI tag product, I can make sure that other people from different regions do not produce the same good and sell it under the same name, because that is a fake good, because I am the person who is originally in charge of this good. So the right holder can prevent its use by the third party. So there are certain other advantages in the institution of having a GI tag. So when a product is given the GI tag status, its price increases in the international market, because people start having more faith in this particular product, but because the GI tag as such ensures that there is some amount of quality. So when its price increases, it boosts the export of this particular product into different parts of the world, and it can also boost the tourism. And especially the poor farmers who produce a GI tag product, poor farmers or poor artisans from a particular region who produce this GI tag product, they will be able to gain more income. They will also face less competition from fake people who are selling bogus products, and that is how these farmers are going to be benefited. So this is some basic knowledge about GI tag, and for how long GI tag is valid. It is valid for about 10 years. Now in order to implement this GI tag, somebody has to implement it from an international level, somebody has to implement it from a national level, right? From the international level, WTO's agreement on trade related aspects of intellectual property rights, which we call it as TRIPS, that regulates the GI products. And from the perspective of Indian government, geographical indication of goods act करके एक है, you have the GI Act of 1999. It basically makes sure to implement the GI tag. It basically provides the legality for the GI tag. So this is the concept of GI tag as such. It basically ensures that there is a certain amount of quality, distinctiveness and security to the person who is dependent on this GI tag. So having said that, what is the highlight of the article? We will see basically a new product in Kashmir, which is Kashmir Saffron. It got the GI tag. What is this Kashmir Saffron as such? It is basically a spice, and it has a unique color, the saffron color, and the reason why it has this saffron color is because of the presence of high quantity of a chemical called the crocin. Where is it grown? Where is this Kashmir saffron grown? Saffron is basically grown in the highlands, which we call as the Karevas, in the area of Jammu and Kashmir. There are certain special features of this Kashmir saffron which may not be important for the exam, but we'll just list them down. One is it has longer and thicker stigmas, it has a bitter flavor, and it is free of all kinds of chemical processing, and it is the only saffron in the world that is grown at an altitude of 1600 meters. This is an important point. If the prelims question has one of the options as this Kashmir saffron is the only saffron in the world that is grown at an altitude of 1600 meters, is it a right statement or a wrong statement? It is definitely a right statement. So this is what this article says. That should be the discussion for the day. Thank you for your participation, and we'll meet again.